establish that local client base for yourself, once you have that kind of people around you who would trust you and come only to you, I feel it's going to be really good because you can earn really well. So you have to know Carranza in and out to clear this exam. Dubai, it may cost around 42 to 44,000. Okay. Otherwise, you have n number of agencies. You can approach any of these agencies and get the process done by you.
Greetings and welcome to your channel Dental Treasures. In this episode, we'll explore the topic of practicing dentistry in Dubai. If you're looking to work as a dentist in UAE, it is very important that you have the right qualification and a strong work ethic. The exams will be tough, but with the right preparation and guidance, you can build a successful practice in Dubai. We are pleased to have Dr. Sheza Shanavas with us, who's going to enlighten her expertise on Dubai Health Authority exam, aka DHA exams. My good friend and former batchmate Dr. Sheza Shanavas has completed her BDS in Sri Rajiv Gandhi College of Dental Sciences and Hospital, followed by which she's completed her MDS in Periodontics in MS Ramaiah Dental College. She has been working in Partha and Apollo Dental Clinics. Currently, she's exploring her talents as a medical writer, and also she's recently cleared her DHA exams. Greetings, doctor. Welcome to the show.
Thank you so much, Prince, for having me on the show. I'm just happy today to be here and share whatever knowledge I have, whatever information I have gathered in the past 5 years with you and your viewers.
So, Sheza, what are the different type of exams for one to practice in UAE?
Okay, so in UAE, basically there are 3 exams. So within the country, you have 3 exams. First one is DHA exam. DHA is to exclusively practice in Dubai. So if you clear DHA exam, if you have DHA license, you're going to be practicing only in Dubai. Whereas if you want to practice in Sharjah, Ajman or other Emirates, you have to clear this exam called MOH. Okay, then you have on the other hand one more exam, which is HAD exam. Okay, HAD is to practice in Abu Dhabi. So there are 3 different exams, licensing bodies to practice in UAE this is. And this can be converted also. So once you once your license is activated, for example, you have DHA license with you, and you have to activate your license, and after 6 months of your experience in Dubai, DHA can be converted to MOH. MOH can be converted to HAD. It goes that way. So ultimately you can hold all the 3 licenses with time. This is for UAE, and for Saudi you have different licensing body which is called SDLE. Okay, so again the experience also varies between the countries. Like for example, Dubai or UAE will ask for 3 years of experience after MDS, whereas Saudi asks for 2 years of experience. Okay, and I think Oman has a different licensing exam. Same thing goes with Kuwait and
what about Qatar?
Qatar, yes. I was just about to start with Qatar. So Qatar, you don't have to clear an exam. Okay, they ask for 4 years of your clinical practice. Once you gain that 4 years of clinical practice in your home country, you can just do data flow process and then go ahead and start searching for job in Qatar. But this is not applicable for BDS. BDS, they ask for 2 years of experience and you have to take up an exam. This is for BDS. But for MDS, you have 4 years of experience, then you can practice in Qatar.
Sheza, can you guide us how to register for these exams and what would be the fee structure?
So registration for the exam, either you can do it yourself, okay? Otherwise you have n number of agencies. You can approach any of these agencies and get the process done by you, just in case you don't have time, you have work. In that case, you can ask any of these agencies to do the work for you so that you can sit back home and relax. But you want to save some money, you can do it all by yourself. Like I can tell you about DHA, there is a portal called Sherian. Okay, just go to that portal, you will figure it out. Okay, you have to register first, you have to create an account for yourself. Once you log in with your login credentials, you will be able to figure out the step. So it's very easy. And about the cost, data flow, it varies again from country to country. Dubai, it may cost around 42 to 44,000 data flow, this is, and exam registration is a different cost, say about 22 to 23,000, something around that. It just changes a bit every year. So yeah, you can keep aside nearly 65,000 plus you have to also do something called classification in the end, which is to get your eligibility letter. So that may cost another 5,000. So about 70,000 it will take. This is for DHA, but other licensing exams and other countries, I'm not really sure. I feel Qatar it's a little less because you just have to do data flow. You don't have to take up an exam to practice there. So it becomes lesser. So it varies from country to country.
So Sheza, could you please elaborate on the benefits and drawbacks of practicing dentistry in the Middle East?
Benefits and drawbacks. Drawbacks as such, I don't say there are any drawbacks. Like see, if you establish good contacts for yourself, you know a couple of dentists who can help you out and you establish a client base for yourself, then it's good. Just the way we have it in India, it is good. It's in the beginning. See, even when you start your own practice in India, for the first time, it's difficult. It's not an easy job. You set up a clinic, not that first day people are going to walk in unless and until you are a localite with all your family members within the same place. Otherwise, it's difficult. So it's the same thing in Dubai as well. You are new to the country, you don't know anybody there, so it definitely takes time. But yes, once your practice picks up, once you establish that local client base for yourself, once you have that kind of people around you who would trust you and come only to you, I feel it's going to be really good because you can earn really well once you make a name for yourself. So beginning is tough, after that it's fine.
So doctor, what is the format and structure of DHA exams?
So DHA exam, it is a MCQ exam. Okay, so you will take up exam online and you have about 100 to 150 questions. It keeps changing once in 2 years or once in 3 years. Sometimes they give you 100 questions or sometimes it can be 150 questions. It changes, it depends on them how they want to make changes. It depends on them. So you have to score 60 to 70%. Okay, to pass the exam, and you are given a period of 2.5 years to clear, to finish the paper. 2.5 years you have to complete.
So doctor, what are the important topics and subtopics to be covered while preparing the DHA exams?
Okay, basically see, this is a specialty exam. Now as MDS you will be clearing exam exclusively for my example periodontics, for you endodontics. So it goes that way. You have to prepare exclusively topics related to perio with little bit of basics. That is also something relevant to your subject. Okay, so what I say is that for us the most important textbook is Carranza. So you have to know Carranza in and out. To clear this exam, in and out you have to know Carranza. They can ask you a question from any corner of the page. So at least there are some main topics, like for us it would be treatment plan, diagnosis, prognosis. These are the main topics for us. And again, aggressive periodontitis, chronic periodontitis, ANAG. These are some very important topics and you should know them in and out. Anything can be asked from anywhere. And all the articles relevant to these topics also you have to be thorough. You should know in and out, especially the recent ones.
Okay. So what about the BDS?
BDS, initially it used to be just basics, but now they are again asking BDS also clinical scenarios. So basically they're trying to assess how good you are in clinical practice. That's what they want to know more than your theory knowledge. Theory knowledge you just get like 10% of questions is what I feel. Even for BDS now it is all clinical oriented questions. So they will give you clinical scenario and you will have questions related to clinical scene. So how good you are with managing, sometimes it can be medical emergencies. So that's how it goes. 2 to 3 months. You have to spend 2 to 3 months exclusively studying for the exam. Prometric exam center is such that it's not that only DHA or MOH exam is happening. There are other exams taking place. So you will basically see people from, you are in a lot of stress. You're really stressed because you have a timer, Dental Gulf Prometric and Prometric.